My name is Giselle Artman, and I've had the pleasure of interviewing Kelley Frazier, a GuinFit program manager, and Slattery, a student contributing to the program. YSU has received funding from the CDC REACH grant to support sustainable policy, systems, and environmental changes that promote healthy behaviors within the community. The GuinFit program is an inspiring example of how these efforts are coming to life. Let's dive into the conversation.
So my name is Kelley Frazier. I'm the program manager for GuinFit, and GuinFit is the recipient of the CDC REACH grant, and we are implementing racial and ethnic approaches to community health. So I'm the program manager, and I have 3 program coordinators, well technically 2 program coordinators. So we have 3 strategies that we're working with under this initiative. We have a physical activity strategy, we have a healthy family weight strategy, and we have a nutrition strategy. Our lead dietitian is Molly Oder, and she handles the nutrition component, the nutrition strategy, and then Dalton Campana is our program coordinator for the physical activity strategy. So he really focuses on making sure that our streets are safe, looking at different ways that we can make physical activity more accessible, making sure that our community members have access to physical activity outdoors, can maybe even use their cars less, using bikes to transport around the city, things like that. Adenuke Ibrahim Ojuau is our program coordinator for our Family Healthy Weight program, and that is really an intensive program where we're really looking to target our children and families between the ages of 2 and 17, and we're really working to bring families together to work on healthy lifestyles. We find that when families do it together, our children are more likely to maintain that sustainable lifestyle. I wasn't here for the start.
Oh.
So, but what I can tell you is that Dr. Poe, she's no stranger to this grant. She's done this type of work before, and she's seen an opportunity to bring this to YSU, and in fact we're the only institution in the area, or in the state of Ohio really, that is a recipient of this grant. So she really sees this opportunity for us to really make a difference in the community.
My name is Slattery. I am getting my bachelor's in sociology with a minor in public health, and I'm a senior. So my role as student peer health educator for the GuinFit grant is to create materials and promotional activities for students on campus to kind of get plugged in with GuinFit, just to overall increase students' activity levels, ideas and knowledge on nutrition, and things that they can do in their community and on our campus already that will benefit their health and wellness. Over the summer, we were at the Youngstown Fleet, which is over by Penguin City, and we kind of increased the community's knowledge on the walkability of Youngstown. It's really easy to tell people to go outside and exercise, but if there's not walkable sidewalks or safe places for them to do that, it makes it a little hard. Recently I've been trying to conduct some research regarding our vending machines on campus. I've been running into the challenges of it's kind of hard to get some information from our vending machine operators to just kind of collect data on the nutrition of our vending machines. I think our overall goal with this project is to just increase healthier options for students on campus. Our dining services has done a great job with that, but we just want to make sure we're hitting every little pocket on campus that we can. So maybe reorganizing our vending machines, putting healthier foods maybe at a higher level or around the outside, wherever somebody would be looking right towards, or just maybe putting healthier options in the vending machine would be really helpful.
Right now we have 7 students involved, and they are working closely with our program coordinators as support, helping out with data collection, going out into the community. That's our long-term goal, for them to go out to the community and do different assessments, help out with demonstrations and things of that nature. Also doing things on campus, because we also want to focus our efforts on campus as well. Even in this short period of time that I've been here, I'm starting to see small differences which lead up to bigger things. We're starting to see a little bit more focus on taking the stairs, more focus on as opposed to the elevator, more focus on making good choices in the vending machines and in the dining commons and things of that nature. So we're starting to see those things, and we're hoping that they'll spiral into bigger things and kind of spread larger. The only challenge that I would have foreseen is working with community partners, but that actually hasn't really been much of a challenge. The community partners that we're working with have really been on board, have really been open to doing this and really working to partner with this to create a bigger impact. So what I thought was a challenge actually isn't showing to be much of one. We have a work plan that we work on each year, and where we think about what activities we're looking to do for the year. So we start at the beginning of the year and kind of work from that. So we sort of pre-plan our year. Right now we're really working to implement that Family Healthy Weight program. Last year was really a planning stage for that. This year is our implementation. So we're looking to get that off the ground in the spring. And we're working with community partners to be hosts for this program to help us get referrals. Because our target is, our main focus is combating childhood obesity. But again, we figured roping the whole family in would help create a more sustainable lifestyle for the children. With our physical activity, we are still implementing safe street demonstrations, and those are just temporary setups to show what proposed improvements could look like and how they would benefit the city, how they would benefit the communities. And with our nutrition, we're looking to implement, our dietitian has been out assessing food banks, looking at the different foods that are being given out. And we are working to implement some food voucher programs, produce prescription programs. So hopefully within the next few months, we can start to kind of work towards those things also. Well, we're focusing our efforts, of course, like I said, in Mahoney, Trumbull, and Columbiana. My goal is, what I would like to see is for neighboring counties, even though those are not our target areas, for us to be the example for those, and then maybe we can work in the future to bring some similar programming to other counties, Stark County, Summit, Cuyahoga. So I would like to see a bigger reach from what we're doing.
I think that this project has definitely had an impact on my health and nutrition and how I view food when I'm picking them out for myself. It's not necessarily something that I've always had to focus on. I've known that I needed to eat healthier, but it's easier to look for better snack options for sure, especially when I'm on campus. And I think it's impacted my career goals by just showing me that there's so many different ways to reach a community, even just our smaller Youngstown State community, and how we can extend our knowledge and activities out to the communities around us.